What are the signs to look out for to know if my child is vaping or not? So as a parent, I want to know, how am I going to find out if my child is vaping?
Yeah, so I guess it's not that easy. It can certainly be challenging to notice. And as we've heard, vaping and vapor doesn't smell like the odor of cigarette smoke. So vapor can have either no odor and smell like nothing, or it can have really and other flavors. So as we've heard that bubble gum, other really sweet flavors, pineapple, blueberry, and so depending on the contents. It also depends on what the actual purchase is. So if it's a cartridge that's already pre-made with flavorings, or if the young person is actually making the e-juice, and so what's actually in the contents of that. So is it THC, is it marijuana, for instance, in which case that's what the vapor itself will smell like. Some of the signs, and this doesn't always happen, that you might notice is particularly kids who have underlying respiratory conditions like asthma. They might have increased shortness of breath, for instance. They might get, have that with exercise, which is unusual to what their usual behavior is, and that might be a giveaway. Vaping itself can cause dry mucous membranes and dry mouth, and so you might notice that your child is drinking more than usual, drinking water more than usual. And I guess also it can make you feel sick as well. So it's not just the respiratory problems. It can certainly give you nausea, vomiting, tummy pain. So anything that's kind of unusual might be a clue, but again, it's not always easy. I guess the last thing that sometimes is one of the presenting symptoms, and certainly one that I've seen a lot, is that behavioral change, the mood swings, agitation. So that's really in response to how nicotine works on the brain. So if there's, if your child has more mood swings, agitation, inability to concentrate, there's a change in their behavior, it's certainly worth thinking about vaping and asking the question.
Thank you, Vikram.